Kinz Ul Eman of Dopasi Foundation. Civil society engagement in communities is integral to the work done by the Pandemic Fund. And the project, Pakistan's project, is just getting underway. From your perspective, why is civil society involvement so critical?
So just coming in for any Pandemic Fund project, not just Pakistan, civil society engagement is key. We have been talking about financing for this whole time, and we have been talking about when we are so-called in a state of peace, not in a state of just like the COVID emergency that we were in. Civil society brings in the trust. It's basically the connecting tissue between the global stakeholders, the policymakers, and the community at large. They have the reach. They can reach where MDBs cannot reach, where multilaterals cannot reach, where even the ministers cannot reach. They have the legitimacy. A person sitting in one of the rural villages of, be it Lebanon or Pakistan, will not listen to an IE coming in, but they will, if I tell them to move from someplace, or if I tell them not to get out of their houses, they will listen to the civil society, they will listen to their local communities, their local leaders. So, and then they have the space and muscle to be the voices that can actually bring up an issue. A multilateral or an IE might not, or even an implementation organization, the big implementation organizations, cannot actually voice the concerns to the government when they need to hear. There needs to be a devil's advocate out there to ensure accountability, both upside in terms of whether we're sticking to our mandates, whether we're being effective, whether we in placing all the surveillance systems we're talking about, whether we have those systems in place, and then community-led monitoring actually feeding us in from the lived experiences. Because we're talking about resilience, we're talking about preparedness. I think if we leave the community out of it or the civil society out of it, we cannot be truly resilient in any aspect. Coming in from Pakistan is kicking off its grant again, just like Caribbean mentioned or Lebanon mentioned, Pandemic Fund has supported the country a lot, and there has been super awesome movement from, for the first time, I assume all the One Health colleagues are coming together, sitting together. Ministry has formed this joint working group. There is a national steering committee, so on and so forth. So progress is being made. A lot of investment is happening into the systems, into the surveillance system. The connecting tissue of community needs further strengthening. Plans are underway. There are plans are underway for civil society engagement, and I'll be the biggest advocate, not only in my country, but in the Global South, being the Pandemic Fund Civil Society South board representative. So I will further I had a discussion actually around having civil society in all these steering committees, not only from an implementation perspective, not only from a beneficiary perspective or an implementer's perspective, but actually having a seat at the table and having a voice in the decisions that are being made for us to be truly resilient, and that is what is the need of time.
Outstanding. That's involving the civil society and the community sector is really key. You're very passionate about that. Thank you for sharing.